discuss is Parkinson's disease, which is a movement disorder. In fact, it is the prototypic movement disorder. And a movement disorder, by definition, is a neurologic condition in which there are abnormal movements or abnormal coordination, but the muscular strength is actually retained. And the four cardinal features of Parkinson's disease are resting tremor, or an oscillation when the patient is at rest, to and fro of a given joint; cogwheel rigidity, which is stiffness at the joints, and usually of a quality as if the patient, as he moves, has a give and take, like the cogging of an old mill wheel. The third feature, and the most prominent feature, is bradykinesia. Brady is the Greek word for slow, and kinesia for movement. So even though the patient's strong, he cannot coordinate his movements and is slow, and there's breakdown in the coordination and agility. And the final problem is a walking problem, in which there are small steps, stuttering gait, difficulty turning, and in fact, there can be a balance problem associated with falling. There are two basic questions in the world of Parkinson's disease: what causes it and what allows it to progress over time. And related to this issue, there are two basic issues in terms of the anatomy and the pharmacology. There is a cellular problem on the one hand, and there is a chemical problem or pharmacologic problem on the other. At the cellular level, there's a microscopic population of cells. Microscopic, but nonetheless pivotal to the coordination of movement, and those cells have started to die. They still exist for years and years of having Parkinson's disease, but they still, at the beginning of the clinical diagnosis, they are deficient. We do not have a current treatment to save those cells as far as we understand. The second problem is a chemical problem. And whereas we have a great challenge to identify the cellular origin of the disease and how to stop that disease from killing off the cells, we know all about the chemistry. Those cells that are dying, they make the chemical called dopamine. And we know all about dopamine, and we know how to augment or increase the dopamine in spite of the cellular loss. The issue at hand, of course, is how to diagnose it and how to choose the right treatment. And that takes specialized training for the best and ultimate care, in my view. Movement disorder specialist is a neurologist who has been specifically trained in this field to recognize and diagnose the condition, and also to walk through and be a partner with the patient as he or she travels the many years that will endure with Parkinson's disease. Our aim is to keep the quality of life at a high level, and though we cannot cure it, the emphasis is on making the lifestyle independent, respectful, and safe.